Columbus City Schools nurses and union members say the district is in a state of emergency and nurses are overwhelmed. The group rallied outside the Board of Education's meeting tonight in an effort to have their voices heard. NBC4's Karina Chung was there. Karina, what did the nurses have to say, and did the district have a response?
Well, the nurses say they feel like they are overworked and they feel that there is little communication with the district. Now, on the district side, Superintendent Dr. Talisa Dixon did address some of the concerns in her superintendent's report tonight. However, she was not available to speak one-on-one after the meeting. Dozens of Columbus City Schools nurses calling out for help.
It seems that the responses that we usually get are, we'll get back to you.
The group gathered to declare a state of emergency. They claim they're overwhelmed by contact tracing, protocols, and little communication, which is impacting their daily duties.
In the absence of a nurse, a secretary or a trained staff member is literally helping a child administer insulin. I'm a former ICU nurse. And when I worked in the hospital, we had to have a 2-nurse check for insulin.
CEA nurse rep Jackie Broderick Patton expressed concerns over working past school hours.
Unfortunately, since we are lacking experienced leadership in our health services department, that extended time has not been boarded.
A spokesperson says that extended time was recently approved at the September 21st meeting, but cannot exceed 111 hours per person. Superintendent Dr. Talisa Dixon addressed some other concerns in her superintendent report for Tuesday's meeting.
We are committed to allocating resources that will alleviate the ongoing process for our own school staff members.
We're told a contract is in the works, but will only aid contact tracing for nurses, and it will still be their responsibility. Another resource in the works.
We will begin distributing free rapid COVID tests for any student or staff member in a school or transportation center who is symptomatic or a close contact of a positive case.
Broderick says she wants to see these issues addressed sooner rather than later.
What I fear is that we're going to lose those new nurses and then everybody in between, because we all know there's a nursing shortage.
Nurses did say some cases and times take a full day to contact trace. Now, CEA also had a list of measures that they would like to see Columbus City Schools take, and that includes having more people being trained for contact tracing, but also task forces in all of the schools to make sure there's compliance with all health and safety protocols. Local for you in Columbus, I'm Karina Chung, NBC4.
And we should mention the Columbus Education Association is calling for immediate implementation of specific health and safety measures. All of those details are posted on our website, NBC4i.com.